Hello, my name is Jara, and today I'll be doing one nursing skill. It's called the nasogastric tube insertion in children. So in my case, I'll be doing this in an infant. She's about 2 months old. You would like to know the indications for this procedure. Usually, the client cannot swallow by mouth, or they cannot get any sufficient diet because they cannot swallow. We do this kind of procedure. Sometimes also we would like to suction some stomach contents so that they would be you would prevent some nausea or gastric distension from the patient or vomiting. Sometimes you also get some like stomach sample for lab analysis. You would send that to the lab, or if there's an accidental overdose, you would like to flush or wash the contents of the stomach, you do this procedure as well. Sometimes if there's any poisonous substances as well. So you would like to first assess your patient and see if there's any history of nasal surgery or deviated septum. So you would like to check on your chart if there's any history. You would like to check which nair is the best nair to use in this kind of procedure, because you don't want an occluded nair or any obstruction in that nair, because it's going to be hard for you and it's going to be uncomfortable for the patient. So just get your pen light and assess which nair is the clear one, so you would do this procedure on that side. So in my case, I chose the right nair because it's the most unobstructed nair, and I would position myself on the right side of the patient, so it's easier for me to do this procedure for the patient. If you chose the left side, then you position yourself on the left side of the patient. So want to make sure that you get your blanket to swaddle the baby, just so the baby would be restrained, and also explain to the client's guardian what this procedure is all about. That way they could cooperate with you and help you with this kind of procedure. So first, I would like to gather all my equipments in the room. So for my equipment, I'll be using clean pair of gloves. I'll be using my NG tube, and depending on the patient's age, you would determine the size of the tube. For my patient, she is about less than 4 months old. She's about 2 months, and I would be using a 5 to 6F NG tube size. That's if I'm going to be feeding the baby or putting some medication. If you're using it for decompression, you'll be using a 6 to 8F size for this age of the baby. So it depends on the size of the tube on the baby's age as well. And then you would like to get your pH strip ready, some sterile water, micropore dressing. You would like to prepare two dressing, the primary and the secondary dressing. So in my case, I already prepared it. Put it on the side so it's easier. I'd get my blunt scissors, disposable pad if needed, marker, an aspirating syringe, just to verify the contents, and just position the patient in a 30 to 40 degree angulation in a supine position. And then you would like to identify the patient, full name and date of birth, 2 identifiers, verify it with the guardian or the parent, and then verbally ask a consent to do this procedure for the baby. So you explain to the patient's mother why you're doing this procedure. That way they would understand, you would establish rapport, and at the same time they would cooperate with you what you're going to be doing for this procedure. You would have to help. You would let them help you to do this procedure by holding their baby to restrain their baby better. So first, as soon as you've identified the patient's name and date of birth, you would like to provide some privacy as well. Close the door, the window. That way, you don't disturb the baby, just in case the baby will cry. So after you do that, you would like to, wash your hands, perform a hand hygiene technique, get your clean pair of gloves, and first you would like to get your primary dressing. Put it on the side of the cheek, so on the right side of the cheek. That way you don't cause some skin irritation when you're doing this procedure. And so in that case, that's where my dressing would be. And then get your NG tube. So just make sure that you get the correct size, so 5 to 6 for my case. And then there's an NG portal exit. you would like to position that on the tip of the right nair, and just, you know, run it to the tip of the earlobe, and then from the tip of the earlobe you would run the tube up to the xiphoid, the tip of the xiphoid process. And once you're there, you would like to check where the umbilicus is, and halfway there, that's gonna be your mark. So you would like that mark there. Get your pen and mark that area, or get your micropore and wrap it on your tube. And as soon as you get that size of your tube, you would like to dip it on the sterile water, and then just gently advance it into the nose of the nostril of the patient. In my case, I'm going to do it on the right, so just gently insert it, and in a downward motion. Usually the tube is already in a curvature, so just try to advance it even more. And then as soon as you reach the nasopharynx, the child may cry, or, you know, just stop when the patients cry, and then proceed until they're more comfortable. And then just get your pacifier, let them you know, suck on it so they could swallow, and see if you're on the right tube. You would like to do this on the esophagus, not on the trach, because if you're positioning it on the trach, then you're positioning it in the lungs. You don't want that. You would feel the patient choke, and you know, you would see the patient turn blue, or they would just cannot, you would see that they cannot breathe. Then you're on the wrong tube. You have to withdraw that tube immediately, and then start the process again. So in my case, I'm good, so I'll be advancing it even more until I reach that mark that I made initially. So as soon as I mark it, as soon as my mark is on the tip of the nair, you would like to get your secondary dressing and place it on the tube to secure it, so the patient does not dislocate the tube. And just place it right there, and get your aspirating syringe and get it to hook it up to the end of your tube, and just aspirate a little bit of contents. And usually, you know, you'll see some contents here, and get your pH strip, and then put that content on the pH strip, and wait until the color changes. Usually there's color changing. Just you know, measure it. You would like to get about between 1 to 5 pH level, because if it's more than 6, then those are not gastric contents. Usually gastric contents is acidic, so it should be between 1 to 5. So in my case, it turned you know, number 4, so it's about 4, which is good. I verify that it's the gastric contents. And then just secure the rest of the tube on the side, or clip it on the patient. That way it's not getting dislocated. And then after that, you would like to you know, take off your gloves, discard them in the trash, and then wash your hands, perform your hand hygiene technique, and document your findings. You know, you would like to document the date, the time, the size of the tube, the pH level that you've got, and, you know, all the necessary information that you've obtained in this kind of procedure, the equipment that you used, and all the proper documentation. And then once you do your documentation, you would like to evaluate the patient. You sometimes, if you really want to, you know, get exactly where the position of the tube is, usually they would take an abdominal x-ray, but in this case it's an infant. You would like to take away as much as radiation from them. Usually for adult patient, you would like to take an abdominal x-ray to verify that the position of the tube is in the stomach area.